Hello, DIDA friends. I am Dr. Nitin Bhat, prosthodontist, practicing in Dombivli for past 37 years. My wife, Dr. Sonali, she's an oral surgeon and she's practicing for almost now
30 years.
30 years. It's a great pleasure to be again with DIDA and का फिरावं माणसाने का फिरावं त्याचं सर्वात साधं उत्तर आहे की टुरिझम किंवा पर्यटन हे माणसाला भरपूर काही शिकवून जातं, चांगल्या गोष्टी वाईट गोष्टी. आणि डेंटिस्ट असल्यामुळे both of us would travel and always look for some conference, some trade fair or some clinical course, and we would always couple it with our leisure tourism. It began in 1996 when I traveled to Belgium and Germany, but that was for 6 months of internship in implantology, and then we realized that Indian conferences do offer us a lot, but that is pertaining to whatever knowledge that is being gained by those dentists in India. So we wanted to explore more. More or so, the dental trade, one of the biggest asset of dentistry is we have instruments and materials which can range a huge scope. So we would attend all the trade fairs, and Sonali knows that I have never missed FAMDent, ExpoDent, Maharashtra state conferences. I probably may not attend scientific deliberations, but trade fair that is what attracts me. So it's like a small boy in a chocolate factory. So whether I buy those instruments or not, and usually I'll end up buying most of them. I've made a huge collection which actually can probably have a museum, dental museum, right from Agate spatula, which many of us have learned in Skinner's and Phillips. I've never seen one. I have one. I've never used it though. So we always believed in traveling for education as well as trade, and always traveled together. So I feel traveling does make a man wise. Two things: you learn what to do and you learn what not to ever do. You would like to add something?
It has really enriched our experiences. I have learned few techniques which I would have never used otherwise in the conferences there. And I have got such wonderful equipments or instruments there which I cherish. It has worked very well for me. And accidentally I have got all those instruments, or I have learned techniques. I have met many doctors who are doing all exclusive procedures, which has really enriched our experience over the past years.
Sir, you had opportunity to attend many dental fairs and visit clinic across countries like Germany, South Korea, or China even. How these international experiences shaped your perspective as a dentist?
Yeah, as you rightly mentioned, I have visited clinics in Belgium, Germany, South Korea, Spain, Hong Kong, and US, and I have learned a lot. But I have learned that we Indians are lucky to have probably couple or more assistants, and of course they are not trained ones to begin with, but we need to train them. I have seen dentists working alone in most of the European countries. It's a nightmare. I don't know how do they manage, but they always talk about 400 and 600 dentistry. But I have seen many dentists practicing just 200 dentistry, no assistant and no associate. And then I have seen clinics in Europe, and one of my friend who's a periodontist, he has like 9 dentists working in the same clinic, his own clinic, with nurses and huge staff that can probably more like called as a dental hospital. Another one of my mentor, Dr. Chang from South Korea, his Daegu clinic is a 5-story building with even a kitchen for his staff. so the staff doesn't cook or doesn't get tiffin for lunch. He even has recreation things like a billiards table and a table tennis table for his staff. So something like with his own 3,000 square feet lab, private parking and parking for patients, in-house, everything that you can name. And that was really fascinating, but it's a dream clinic. I don't know how many of us can really achieve that. He also had or has his implant company. He was manufacturing his own implants, and I have used almost 50 of them, and excellent results. So, yes, looking at those clinics and looking at clinics from where it was only two-handed dentistry, things differ everywhere, not only in India. So you have rich practices, you have average practices. So it all depends on patients or clientele that you have. But there is no harm in aiming for high. So what I have done is I always upgraded my clinic every few years. I always upgraded my equipments, and I have always bought equipments that are new, that are easily or probably rarely available, and whatever is new material or instrument is launched in India, I tend to buy it. And I have made terrible mistakes. I have lost good amount of money because of that, because some of them were really not good, but I still have them. My motto is, unless you try, you will not know whether the instrument is good or bad. And I believe rather than listening to a mentor, you should be your own judge of things that you can master and you can buy and put to practice. So it really gives you a good exposure to see from, say, I would say from top to the bottom or bottom to the top. And then you choose where you want to be.
Ma'am, you want to?
I would like to share one story of Mr. Robert Chan, who was our mentor in initial days, and he's learned so many things from him. We were with him for 3 weeks, and one day he decided, like, he'll give us party, and he planned to take us to some restaurant with his friends.
Fancy
6
restaurant.
o'clock. And he finished, like, we have the motivation and dedication what we have learned from him. 6 o'clock we were ready to go, and the receptionist came and told him that there was a patient there. By mistake, the appointment was given and it was not informed to him. It was a full mouth implant case, 6 implants in maxilla with 2 bilateral sinus lifts. So she said, shall I postpone it to tomorrow? He said, nothing doing, I'll do it today, right now. 6 o'clock, he again washed up. He started with the case, he finished it at 8:30, and then we went to the hospital. And he did it so well.
No, it is the dedication. I have seen that man. He's one of our dear and near mentors, and more like family. Unplanned full mouth implant with bilateral sinus lift, I can never dream of. But of course, in their clinics, they have huge number of setups. So everything is ready, everything is autoclaved, the nurses are trained. So it may seem like a cakewalk, but the surgeon has to operate. He doesn't have any replacements, and this guy untiringly used to start work at 8 o'clock in the morning, and he would require us to be there at 7:45 so that he could give us some breakfast, because being vegetarians, it was tough time surviving in Seoul and Daegu, especially for vegetarians. So he used to arrange breakfast for us. So he would expect us to be there at 7:45. He would begin at 8, work till untiringly till 6, with a lunch break of only half an hour. And I have many mentors like Dr. Steenberge, Dr. Nerd, Dr. Tunish, Dr. Chang, all of them, including Dr. Dabir in India. All of them worked so hard, and they still work so hard, eat very less. Very less. So I have realized I can never be that mentor, because I hawk so much that I can never reach their heights. But I have seen them, they eat so less, their body does wonders, but they eat so less. I don't know where do they get the energy. It's the passion. passion for dentistry, and that is what for both of us, dentistry is our passion. That is why wherever we go, in fact, I have been to dental clinics in Bhutan and Nepal. I used to watch, I used to read on the board and just walk in, say that I am a dentist from India and I would like to meet you and say hi and enter the clinic. This, of course, you can do in our part of country. Any other part of the country, especially Western world, you cannot, they will not entertain you without an appointment. But yes, I have interacted with many people, especially in trade fairs and conferences. And that has really helped my thinking. That has really helped our clinical outcome, because what you see is what you can probably reproduce.
In Germany, we had been to that implant factory, the city, Camlock factory, and we realized, my God, what a stringent protocol
No,
they have to follow.
it's something, all implant surgeons and people who place implants should visit at least once
Yes, one factory.
one implant factory. We should know what goes, and especially a good factory like we were lucky that we got to see Camlock's factory, and that was a 2-day course, factory visit and 2-day course. Everything was on the house thanks to Dr. Mukesh Katara of Bio Horizon, and that was an enlightening experience to see how implants are manufactured, what care is taken. That will probably really help you in the cases that you do. If they are taking so much of care, what level of care you should, especially sterilization, you can take you have to take in your clinic.
Beyond the clinical knowledge, how these global visits help you in growing personally or professionally? Like a mindset and confidence approach to patient care, or clinic design, clinic environment, etc.
Clinic design and clinic environment is an amazing factor there, because they have strict norms. They have strict furniture companies, cabinets that will supply. They have strict flooring requirements. They have very strict paint requirements, which unfortunately, or I would say fortunately, it's not possible here in India because we don't have any requirements. But the clinic outset and design, like most of the clinics have something like an oral hygiene bay where the patient can go and floss, brush their teeth, and then come inside the dental clinic, which is definitely not there. They have an oral hygienist, they have a separate sterilization room, they have a separate instrument cleaning room, and most importantly, they have a separate tea or coffee room and even a bed for the dentist to sleep, which is a dream in India, which is very, very, very few people. I know quite a few people in India have it, but they are handful. But the design in the sense, nobody considers airflow in India. So the position of AC to begin with is very important. That it should be away from the clinician. So the clinician should not come between the AC and the patient. Never. But even in my clinic, at one place, we have it wrong. But because we are not a OT. Fortunately for us now, we have followed many of those principles, and in our oral surgery, minor surgery room. So that is one. Another thing is layout I would say the chair really matters a lot. So I bought my first car after 11 years of practice, though I was crazy of buying a 4-wheeler. And my father was really surprised. And I kept on investing in clinic. I probably, in 37 years, I have changed chairs 6 or 7 times. So according to ADA, American Dental Association, you should change your equipments after every 7 years. Well, I am fortunate enough, I have changed it after every 5 years. So I think you should invest in the clinic, in the equipment, because at the end, and it is nothing to do with the patient. Whether the patient is paying you so much or not, you should not, because I spent probably more than half of my life in the clinic, and as all we dentists do. So where you should be more comfortable, where you spend your maximum time of your life. And it should be a pleasure. Practicing dentistry should be a pleasure, and that pleasure is only because you have good quality equipments and materials. Only then you can, because as they say, a carpenter is only as good as his tools are. So to begin with, you should have good tools and you should invest wisely but nicely into dental equipments. And that is why I have been visiting dental trades. I want to see what is new that is coming up, what is I can put into practice, because the continuous zest of how the same procedure, like a simple composite filling, I can do faster and better. So I always want to do from whatever level I am. I may not be at a higher level than many of the clinicians in Dombivli, but whatever level I am, I want to upgrade in quality as well as time, because your family time depends on how fast you can do the same procedure. My wife will definitely not agree with this because she wants to go slow. And recently I came across a beautiful caption about a hare and a tortoise story, and the wording was slow is good. And at times, yes, it is, I do agree, slow is good.
Our approach is totally different. Being husband and wife.
That's why we are husband and wife.
But one thing I would say, like the over the years, what we have seen is the difference between, I mean, the Indian dentist and the global dentist. Like the difference has reduced drastically. Like most of the dentists here are at par with, you can say, except for those high-end practices, they are doing nothing. Anything.
No, I would put it this way, that because they spend probably a lot of time with one patient because the patient is paying them so much. One, and most of them are, whatever practices we have been specialized practices. So we have not been to a general dentist. Very rarely we have been to a general dentist and seen how they practice. I don't want to talk about.
Met one dentist. I mean, of course, on phone for my daughter's treatment. She had to take treatment. The root canal she got it done in.
My daughter underwent root canal in Germany.
It's a very primitive.
Yeah. So the question that was asked was, I asked her because she has a dental insurance. So I asked her, is it covered in insurance? So the dentist was, of course, very happy to hear that her father is a prosthodontist and mother is an oral surgeon. So he asked whether you want to get the root canal done modern way or the old way. So she said, what is the difference? He said, old way is included in your insurance, so you don't have to pay anything. The modern way, you will have to pay 320 euros. It's as good as probably 32,000 rupees for a root canal. And instead of and that is with insurance, 32,000 rupees or 320 euros. So I asked her, please ask him what is the difference. And then he said he will use modern root canal is rotary.
Which we use for
So both of us we started laughing. I mean, this is, well, your modern is probably normal for us 10 years back. All of us are using rotary for almost 10 years. So that is the level of difference with a general dentist. But I have seen some clinicians who excel. That is because they have the passion. They are usually associated with some university clinics where financing is not a problem. So they do research. What is lacking in India is finances for research. So I feel IDA, it's a far-fetched dream, but IDA should have some clinics wherein they give you some funds for research. But I have learned that hard way that you should do your own research. You should do. That is why I keep buying instruments and materials. If you ask any of the trade people in India, they will know that anything new that comes, they have to visit Dr. Nitin Bhat and he will buy. My wife has witnessed that. When I visit trade fairs, most of the dealers, most of the owners, I know them personally and they know me well and they welcome us. So I believe one should invest, try out new instruments and materials. All of them may not be good, but even if 50% are good, I think
Sir, any eye-opening moments or life-changing moments in this from this travel perspective you have noticed in your practice or professional life,
Eye-opening moments.
or any life-changing moments that helped you in a patient? Why we should travel? Because everything is available on internet nowadays. There are many online lectures available, but why we should go personally and travel there?
If you are attending online lectures, it's difficult to ask questions. One, I have been lucky that I have assisted many people, and because in Europe or US you cannot touch a patient. So the only thing that you can do is, being in a university clinic, I was allowed to assist professor, where you get to see live, where you get to see not what they want to show you, but what they actually do. Because there is a hell of a difference in what they show you over the lectures and what they actually practice. And that is a fact with all mentors, believe me, that what they show you in probably conferences is their brighter side. Nobody shows dark side. So you get to see that, and then you come to know, okay, they are only human. They are also only human. They also make mistakes. So it's good, but I believe that you should not make the same mistake again. You learn from your own mistakes rather than, and it is good to learn from somebody else's mistake, but it is difficult to, actually catch that moment where he's made a mistake and he's trying to, cover it.
We were lucky enough to assist Dr. Chan one-on-one, and I feel how much ever you learn theoretically on net, until unless you do it yourself, you will never learn it.
So it's good to do hands-on courses. We have attended quite a few, especially one of them was Ricardo Kern, way back, that was almost 3 years back. In Kathmandu, when this Ricardo came to India came to Asia for the first time. Then I have been lucky enough to participate in Lucas Lanzmann's course. First time he came to India in Delhi, thanks to Deepak Rai. So, and these courses are terribly expensive, believe me. But they are there, standing next to you, holding your hand sometimes to teach you, which is impossible otherwise. No amount of online teaching can teach you that.
In 2006, we learned the sinus lift, direct sinus lift from Dr. I don't remember his
Cho.
name, Dr. Cho.
It was organized the first
He-
sinus lift course in India by Austin.
Stream, and it was a 5-day course, and he taught us so well each and every minute thing, and we had to do it in front of him on patient.
On the 5th day, we had to do a sinus lift on our.
And then each and every surgery, every minute detail he discussed, where you went wrong, what you have done. So I was so confident after that course. I have done now hundreds,
More than that.
more than that, of sinus lifts.
More than that.
And
Almost
after
1,000.
that course, I was 100% confident.
So attending these courses probably cost you dearly, but the amount of experience and exposure that you get, you cannot count in money.
I was coming to that question only, sir. The global visits can cost you much more money in the initial days of practice. So, for the specifically nowadays, the new dentists who are almost lost hope in their career only, dental career. So, how they can travel this globally and how they can recover their cost involved, or any particular tip you can give to this young dentist?
I would say don't attend big conferences, because we have been to American Academy of Osseointegration, European Osseointegration conferences. The charge is very heavy, and in US American Osseointegration, in fact, they charge you for even some specific lectures other than the registration fee. So, and these are limited attendance lectures or courses. So begin with smaller things. The cheapest is probably you can travel to China, Guangzhou, where there is a dental trade fair. Many a times they have certain lectures, especially how hands-on on how to use these instruments, and probably that is the cheapest way. Or you could even attend in Beijing, a trade show in Beijing, where it's not very expensive. You could attend even, we have been for COEX, that is Seoul Dental Exhibition, and which is SIDEX, it's Seoul International Dental Show, where the moment they came to know that we are from India, $100 was registration fee for each person. They said, oh, you've traveled from India, okay, it's complimentary for you. So, and we got to see some amazing instruments and amazing deals. And I'm talking about 2009, 2014. Twice we went to South Korea when it was difficult to get things from South Korea to India. Again, our visit to, in fact, my dream was to visit IDS in Cologne, and which is once in 2 years. We went in 2023, quite late according to what I thought, because I wanted to visit in 2010. It was not possible because of some family circumstances. But there you get to see a lot of clinicians talking on the booth, where you get to see a lot of exposure to instruments that you can use. It's expensive, yes, traveling to Europe is expensive, but you can go by a cheaper airline, stay in Airbnb and go in a group. And the best part is, once you are in Germany for IDS, your travel is free. So you could probably, join a sightseeing tour with this, or probably, save money for, rather than spending on some other things, you may probably. But I think every dentist should visit IDS at least once in a lifetime. And exposure to where, food is on the house. Best experience was in SIDEX, where every company next to their stall had a food stall, which is complimentary. So they don't want you to go out of the exhibition hall at all, even for lunch. So yeah, travel is expensive. International travel is expensive. But see, look at this part. I started my practice in 88. First time I went abroad was 96. That was my first international journey. So almost 8 years later. So don't start on the second or third year. You have to be wise enough with money, pay your debts, accumulate money, and then go.
Ma'am, sir, you both are dentist. So दोघी जण गेले की clinic बंद. So how, what tips you will give for dentists who are planning the international travels, mentally as well, practically as well, financially as well, like handling the clinic at the same time handling the practice, and at the same time handling the finances. How to prepare for this travels?
In the beginning, I was out of country for almost 6.5 months when I was alone. Sonali managed the practice. And later on, all our travels.
Yeah, initially he used to go alone and I managed the clinic. And when we were financially little stable, then we started going together.
So it's always been both of us now.
Managing
Probably that was the only
As that is a useful tip.
Managing the clinic.
One. Second, no, that because I was doing a course on implants and she had just finished her oral surgery MDS and come back. So, but after that, we always went together, right? Always, most of them, 99%. And what I will say is, it's up to you. Depending on the type of practice you have, you could actually have an associate. Depending on how good, trustworthy the associate is. I have been lucky. Later on, probably most of my trips, we had an associate. There were times when we did not have an associate and we wanted to travel for almost 3 weeks or 4 weeks. We had shared 2 numbers. Dr. Bansi Gusari, unfortunately, he is no more. So my patients were directed there. My clinic was open and it was told to all the patients that doctor is visiting abroad because for some conferences, and your patients like it. Believe me, they will wait for you to come back because they know he's spending time and money for education, one. And for emergencies, there is always a handy number of a nearby dentist whom you can trust. And the trust has to be mutual, that when I come back, that patient is going to come back to me. It may not happen 100 times out of 100, for the simple reason the dentist wants to send the patient back, but the patient wants to stick to him because he finds it more comfortable with your friend or more well-equipped clinic or maybe more skillful dentist, and you are going to lose. But ultimately, both of us believe in destiny. So, if you're going to earn X amount, nobody can take it away from you. So, don't be scared of keeping your clinic closed and traveling, because then that way you will probably never travel for leisure or for your career. And one must spend, because see, we are basically at loss because of our currency. So you're not going to visit the same country again probably. So make the most of it. You go for an education, at the same time, see a couple of places where you can actually enjoy a little bit of tourism also. Because you don't want to go to that same place again.
So,
And financially, yes, today it's very easy to get bank loan. So, and moreover so, if you are going for a conference, all your expenses can be included in your accounts. And so those expenses, probably you can claim tax refund, or actually they are into your expense, it reduces your taxable income. So we have always done that. You register, attach the air ticket, and everything has to be done in white. Attach your air ticket, your conference registration, and your stay vouchers. And you can claim those in your expenses, wherein you don't pay tax on that amount. So it reduces your profitable net profit, thereby you can actually earn benefited. So you don't spend your hard-earned money. You spend, but you get a income tax rebate on that because you are showing these expenses. So always couple even your normal tour, even in India. Suppose there is a conference in Nagpur and you want to enjoy Tadoba, register for the conference. You may attend only for one day and enjoy, which most of the dentists do. They go for conferences, but I don't know, not many of them claim expenses for that trip. So you could do that. You can get loan. It's very easy to get loan for dentists or even foreign travel.
So which conferences or places you will strongly advise to visit in a lifetime of dentist?
A must for everybody is IDS Cologne. Once in 2 years, but prepare yourself. Sometimes you will have to walk 10 kilometers to 15 kilometers a day. There was a day we walked 22 kilometers, not outside, inside the conference halls. They are so huge. But the weather is, because it's always in spring, so weather is perfect. It's very beautiful. And the kind of exposure that you will have is, you feel you want to have a cargo plane so that you can buy everything and get it to India, which is not possible. You cannot buy a single instrument in IDS other than some Pakistanis and South Koreans and Chinese, which do it under table. Otherwise, it's only for exposure, exhibition. So, but it's a must. Second, I would say, is Sidex in South Korea. Why in South Korea? Because we love Koreans. Because they give us good instruments at half the rate that Europeans can give us. Far better, they are copy masters, and you can actually bargain with South Koreans. Yes, you can. They don't probably like it, but we Indians bargain everywhere, so why not? I'm not going to meet the same guy again in probably my lifetime. And they manufacture some real good instruments. I've got some amazing deals, like my first pisotome surgery instrument I got in 2014. I got my first down pack of endo, which I don't use because I have a visiting endodontist, but down pack endo way back in 2009, which in people in India had not even heard of it. So, and you can get very good deals, and you have to be smart. Like for my piezo surgery unit, they wouldn't sell it to me. So I told them, I am a dentist from Dhaka and you don't have any dealer, I want to be your dealer. So they said, we will not give you free, but we will give you at a concessional rate. And that is how they sold it to me. So you have to be smart. All Indians are smart and street smart, I would say. So I don't need to tell you about that. But it's for me, dentistry is my passion, like is for her. So we both, but she says you go and buy in trade fair. Abroad she travels with me, so she has no other option. But usually in India she doesn't come for trade. She says trade. She says you manage it.
Personally, I like Cylix. It's really good.
It's-
It's on a mini scale of ideas. And
Yeah,
you can
it's-
bargain, you can see so many different instruments and you feel like you buy this or that. And all advanced. South Korea is
Real-
really advanced.
real-
And
real good instruments.
They have students' papers, presentations outside, on the outside. And I really learned one technique. Like one student had presented a paper there. Extraction of lower 7 with huge granulomas. And apicectomy is really difficult in lower 7 because the buccal plate is really thick. And then you grind that plate and then it is only so you extract the tooth, curate out the granuloma, do apicectomy, seal
Outside
it,
the mouth.
place it again, re-implant it again. And it is worked really well. I have done it in
You've done more than a couple of cases.
no, 4 or 5 cases I've done, and the teeth last for at least 8 to 10 years. I have many cases. So, from one student I learned this. I read the paper and I learned this technique and I used it.
Sir, this is all about dentistry. Now let's come to the personal and family life. Why global travel, or why traveling, or overall why traveling is necessary to have what impact it can have in a personal or family life. Like,
Impact is we spend time together away from your work. One is a bonus, believe me. And visiting different culture and people really helps. And I'm not saying only abroad. Even in India, you can do that. Keeping your mind fresh away from the clinic is always good. So you could actually be taking breaks every 2 months, a short break, which we spoke for a very long time. A number of times we have done that, but we have not. But of late, we have started doing that once in the 3 months, or at least once in 2 months. Take a weekend off, travel, and enjoy life other than dentistry, so that you can come back with a zest and want to do even better than what you did on a Friday evening. You take a weekend off and Monday you want to do even better than what you did on Friday evening. That is because your mind is away from your profession. So it really helps. You get to meet people, you get to see some amazing natural wonders, which, you may be I am not a photographer, but I do click photographs wherever I go. I do talk to local people. Being a vegetarian, enjoying local cuisine has a lot of restrictions, but we still try to do that. So it really is great. It's a vacation, because we have realized at home, even a 4-day vacation in your hometown or at home, you take 4 days off from the clinic and you sit at home, mind is still not away from the clinic. Some patient calling up, some lab guy calling up, your clinic staff calling up. It really is not a vacation. Vacation is you have to be out of Dombivli for us. So it could be anywhere. And it freshens up mind. It gives you a break that, all of us know that. I have not traveled so much. I have probably traveled maybe 29, 30 countries. Not much. I recently, we met one dentist.
From, I think, Gurgaon.
Rajbala Jaju, and she had something like 103 stamps on her passport. I said, how could you travel? She said, you are blessed, your wife travels with you because you are dentist. She has even been to Egypt alone. And I was like, my God. And she said, yes, I have had horrifying experiences at times. We also had some, not horrifying, but some, because we booked one Airbnb in Spain, and that turned out to be a very horrible place. But being together, two of us, but traveling alone for a lady, and she had the guts. I know quite a few people. I know some dentists who probably will not spend on other earthly investments, but spend a lot money on travel. I get inspiration from one of my junior, Dr. Alok Patel. He's a pediatrician from Pune. He's a pediatric dentist. His itinerary is something I really ask him. He's been to Cuba, round the driving around the circumference of Cuba, driving in Iceland. You name the country and he's been to some volcano in South Africa, on the tip of that volcano, and I always follow him. I ask him, where do I should be going next? And then we are traveling to Bavaria, self-drive. Another thing what I have learned is drive. Whenever you are abroad, drive. Indian license is accepted everywhere. But I started driving late in Europe. That was last time was in Switzerland. We drove. So you can avoid touristic attractions. You can avoid the crowd. And you get to see places which most of the tourists don't visit. Because they have no access to a vehicle. And you should be ready to survive on bread and butter.
One funny incident when we went to Switzerland in Interlaken. They have a huge lake, I think. They have buggies. So both of us, that was our wedding anniversary. So both of us were wearing cow hats
and leather jackets.
And then everybody was walking just casually on those 2-3 buggies were standing there and nobody was hiring them. So we thought we'll go and hire them. Hire one other buggy. That buggy we sat with cowboy hats and leather jackets. They thought it's some shooting going on. Hundreds of Europeans have clicked our
more than
pictures.
400 or 500 people clicked our pictures.
Europeans, they were watching us and they were clicking our pictures.
Maybe they thought, what a weird couple.
Any your favorite location, both of you?
It has to be Switzerland. We have been there thrice. Fortunately, we went for the first time in 2019, and Sonali said, I want one of my daughters to come to Switzerland so that we will visit often. Her wish came true. My elder daughter studied in Basel in Switzerland, and we've been there thrice. Next Sunday, I'm going back again. It's out of the world place. It's terribly expensive, but the natural beauty is amazing, and so is Bhutan. So is Bhutan. Out of India. In India, which is our favorite place in India?
Kailas Manas also.
We've been to, but that is again out of India. Kailas Manas is out of India. Yeah, we like to travel not only for dentistry, even for our spiritual sojourns. So we have been to Kailas Manas Sarovar. We have been to Mahakumbh. We have been to quite a few Dattatreya places, Adhishtan places. We have been to Girnar. So even that is another side of our tourism, spiritual. We have been to small places. There is one place near Shirdi, Sakori, which is very famous for Upasni Baba. It's a beautiful place with a very nice temple. Another Dattatreya temple near Badnera, known as Ziri, which is beautiful, very beautiful. In fact, how many of us know there is a Dattatreya temple near Dagdushet Halwai Ganpati? Amazing Dattatreya temple, just 500 meters from Dagdushet Halwai. I didn't know till last weekend when I visited. So that is another part of our tourism, spiritual tourism.
So any message or one-liner for fellow dentist?
Work hard, earn a lot, and travel a lot. Make life a big fun.
Thank you so much, sir. Thank you.
तो बऱ्यापैकी एडिट कर बरोबर